days when they're really physically active. So we recommend exercise highly. They should check their blood sugar before they do it, see if they need a snack. Also, as we said, affected by injection site, they should wear medic ID. Emotional issues, you could spend an hour on this. Kids with diabetes can feel very different from their peers. You know, all the books say this, you can live a perfectly normal life with diabetes. But what is normal about checking your blood sugar 4, 6, or 8 times a day, giving yourself shots however many times a day, thinking about every mouthful of food that you put in your mouth? I mean, that's not normal. That's unusual. That's different. And kids don't like that. So they try to ignore their diabetes, but it's not something that you can ignore. And it's not just for 2 weeks. It's like for the rest of your lifetime. That's tough. Also, the right to privacy. Little kids will tell everyone in Kmart, I have diabetes. Older kids want no one to know. So you have to let them know. You need to let some of your friends know, or let your teachers know, because if you have a low, you want people to know it's probably from your blood sugar, not because you've been doing drugs or drinking or whatever. But kids are afraid of sudden changes in their blood sugar, especially at school, so they'll tend to keep them high. Kids can also feel guilt, feel very angry, feel very dependent, feel very anxious. And sometimes little kids don't know what's wrong, but they know there's something in their body that's not working right. So hard for them sometimes to understand. You want to assess their level of functioning, observe them. Depression. Depression is a major issue in kids with diabetes, and we don't even think about it. The depression inventory on kids with type 2 is higher than the depression inventory scores on kids with cancer. That's pretty shocking. So we need to really be aware of this and get them into counseling if we feel like they need it. We also want to not blame them for everything that happens. Hormones happen, stress happens, illness happens. They're not responsible for each and every blood sugar, but we want to provide encouragement and understanding and reinforce the positives. If they check their blood sugar, that's wonderful. If they remember their insulin, that's wonderful. If their A1C is lower, that's wonderful. There's so many things that we need to emphasize the positive, and they'll try to live up to that. On sick days, you always need insulin. You may reduce the dose, but you still need it. Sick days, you're more likely to get ketones. Ketones make you have tummy cramps, nausea, and vomiting. You can have ketones even if your blood sugar is 22. And the reason you can do that is if you've had nausea or vomiting or diarrhea, you're not absorbing your food, your blood sugar is low, you don't feel like eating, someone's afraid to feed you because you're going to throw up, your blood sugar is low, but your metabolic needs are still high because of the infection or because you still need insulin. And so you can have large ketones. So in that case, you need to page the doctor on call, and we help you with that. We may need to adjust the dose up and down during illness, but you're going to need the insulin. Check the ketones at least every 4 hours or every voiding during illness, and keep a close eye on the blood sugar, and page us if the ketones are moderate or large. They can take over-the-counter medications such as Tylenol and things like that. It's fine. They may need increased oral fluids, gradually as tolerated. They may need a different diet if it's a gastroenteritis or something. If they have ketones, suspect with a kid that's given their insulin independently that they may have missed a dose. Just because they're nauseated and vomiting doesn't mean it's a gastroenteritis. It could be ketosis just from missing insulin. And if they can't keep fluids down or there's a change in their breathing, take them to the nearest emergency room because they're at increased risk for DKA. And these symptoms can occur quickly or they can occur over time depending on the kind of insulin that you're on. If you're on a pump, the DKA is going to develop over a number of hours. If you're on Lantus and some other insulins like that, it may be a little more gradual. Ketones and DKA may be an indication of a pump malfunction or disconnection. And so then you want to provide it from an injection, not from the pump, until you figure everything out. In terms of a pump, people always ask what are the requirements. Well, you need to be motivated. You have to have realistic goals for what the pump therapy is going to achieve. Able and willing and doing lots of blood sugars at least 4 or 6 times a day. You need to be able to intellectually operate the pump. That's why I would never be on one if I had diabetes. I'm mechanically challenged. You have to have effective coping mechanisms, a support system, and the financial resources. This is what our body usually does. It gives us little amounts of insulin all day long called basal insulin, When we eat, our insulin levels go up, and then they go down. We're mimicking that on the pump, which is not quite as good as the body. Remember, we will never be a pancreas. So it gives you a long bolus, a little bit all day long, and then basals, and then you take a bolus or an increased dose of insulin whenever you eat or your blood sugars are high. And you learn to think like a pancreas. So, children are different from adults. They don't think the same way. Kids don't worry about when they're 30 or 50 or anything like that. They're living for the day. We worry about it because we think long term, but their brains just aren't capable of that. So they don't worry about tomorrow. Also, the body size affects insulin dose. As they grow, we need to increase their insulin. We need to be concerned about their growth and development, and puberty especially affects the blood sugars and insulin doses. Kids need to have the physical skills to perform tasks, and people always say, when is a child old enough to do this on their own? Well, whenever they're ready and able and smart enough. I always know when kids are in charge of their diabetes, because when they come in for the visit, and I say to the parents, how much insulin did they take at breakfast? And the parent goes, how much insulin have you taken at breakfast? I know that the child is in charge of their diabetes. And I have 8-year-olds or 7-year-olds who are in charge of their diabetes. Well, diabetes is complex and hard to manage, even in really smart, motivated, capable adults. A 7-year-old just can't do it. They need the thinking skills to make the right decisions. Teenagers are never capable of thinking skills to make the best decisions. And there's all sorts of variation in their diet, their exercise, stress levels, health, all sorts of things. So remember, your child is still a wonderfully unique person. They always were. We just need to help them to keep things in balance. There's nothing they can't do. And I will leave you with one final thought, because I see parents out here, potential and actual teenagers, and God invented adolescence so that when kids are ready to leave home, parents are ready to let them. So I felt like I was preaching to the choir here because you all are experienced in this. I was hoping that there'd be a lot of newly diagnosed kids, but I don't know if you got any information from that. So thank you for coming, and let's go shopping.